and a very warm welcome. Thanks for tuning in to this special medical webinar, Samajhdaar Raho Sehat Ke Ishare Samjho. This is, of course, a CSR initiative by USV and Halt, Heart Attack, where we're essentially trying to decode the myths and dispel the queries about diabetes and heart attacks in our country. Today, we're going to be focusing on one of the most important topics for every family, and I think हम इसकी ज़्यादा बात नहीं करते हैं. We're talking about a healthy heart and a healthy life that leads to a healthy heart. Heart disease is a global concern. We all know it. But the good news is many of these heart ailments can be prevented with simple lifestyle changes. बस थोड़ी सी awareness or thoda sa action. That's all you need. And this is not going to be a lecture. Our previous webinar was equally a hit. You can catch that across various media, websites of the Television 9 network. It's an interactive session, which is again going to be the case today. So please feel free across all the people that are joining us on our webinar to please switch on your cameras, show us your beautiful faces, raise your hands, or you can drop your questions in the chat box. हमारे doctors अभी इसी समय आपके सारे सवालों का समाधान और आंसर यहीं पर on this live webinar देंगे. Our doctors will be answering them live. आपके सवाल उनके जवाब directly hear it from the experts. And we're honored to have with us of India's leading cardiologists. Let's get the snowball rolling without wasting any more time. These are busy doctors, let me tell you. They're taking out crucial time from their daily schedules. There are many people that are, of course, waiting their services in various OPDs. Joining us, Dr. Dhamodaran K, Senior Consultant Interventional Cardiologist, Apollo Hospitals, Chennai, and Dr. Vilas Magarkar, Head of Cardiology, Seth Nandlal Doot Hospital from Samajhdaar. So let's get started with this journey towards a healthier heart and a healthier life. चलिए शुरू करते हैं. आइए बात करते हैं सबसे पहले Dr. Vilas Magarkar, who is also with us on the broadcast. Doctor, very warm welcome to you. Many thanks for taking out the time. I certainly do understand and agree that you have a busy schedule that's lined up for you. And when I was going through, your own designation, it doesn't come short of, honoring a war veteran with all the, medals that they've gotten. We're talking about DM, MD, FACC, FSCAI, FESC. My apologies if I'm not doing justice to that long list of laurels and accolades that you have to your name, Doctor. Many thanks for joining us here. Many thanks to all the viewers. And I will be putting across some questions, put you on the spot, Doctor, because many times you're the person who's putting the patient on the spot when it comes to heart ailments. This time, Doctor, collectively, everybody who's joining us on the webinar will be putting you on the spot. So get ready for those questions. But let's warm up. Constantly I've been seeing, Doctor, we try to compare our life with how many cigarettes one is smoking. Come winter season, when there's pollution in the national capital, people start saying, okay, if you're traveling outside in Delhi, this is equivalent to 10 cigarettes. If you had 2 samosas, this is equivalent to so many cigarettes. So is sitting down the new smoking? Is sitting down really that bad for us? Because, I'm sitting down on the anchor chair for about 9 hours, 8 hours, in the entire day. Is sitting the new smoking? Where do you stand on that comment?
Yeah, true. As you rightly said, sitting is not good. Sitting idle for a long duration is not good. Exercising is very important. Doing regular exercises is like mandatory nowadays. We Indians, Southeast Asian people are very prone for heart problems, heart attacks. And if we do not do the regular exercises and if we have the habits of nicotine addiction, then we are very prone for heart attacks. The chances increases or multiplies subsequently. Sitting, like you can compare it with a car which is, if the car is not, it is just parked in the garage and it is not moving, then there is a chance of having engine problem, chances of having tire problems and everything.
Right.
So if the car moves little bit, if there are some small movements also, exercises which we do regularly, so that helps the person to move the way the car engine to move.
That's a great analogy, Doctor. Let's take that car out of the garage now that you've spoken about it. And, let's talk about this entire aspect of moving medicine that the doctors and the doctors fraternity keep on talking about. If you keep on moving, if you keep on, enduring your physical activity in the day, it can prescribe its own cure. So when I'm talking about exercise, what kind of exercise would you, let's say, recommend to somebody who doesn't do any kind of activity in the entire week? One wouldn't want to go to the gym and start, pumping up some iron. You'll have to take it slow and easy. And at that front, I've been getting so many questions about the timing of walks. Should it be a morning walk? Should it be an evening walk? I think the timing doesn't necessarily matter as long as you actually get out of the house and do some walking.
First, it is important to do some exercise than not doing anything. That is very important. Keep moving. And the best exercise is walking. Walking, brisk walking, jogging, because it does not involve any cost as such. It's very easy, can be done anywhere. If you do a moderate intensity, 150 minutes a week exercise, then that is definitely going to give you a lot of health related benefits. And these benefits are numerous, like there is reduction in the blood pressure, there's reduction in the sugar level, the HbA1c, which is an average 3 months of sugar that comes down. It helps in weight reduction. It gives some, improves the mental strength of the patient. It gives the strength to the bones, muscles. It reduces the stiffness of the joint. Walking, brisk walking, jogging, cycling, swimming, yoga, power yoga are certain simple exercises which one need to do. One should do it minimum 150 minutes a week. I am recommending, like, if you are lazy, you can take Saturday, Sunday out, and you have to just do 30 minutes a day exercise for 5 days and change the pattern of exercises. And that will help you. And at least has been scientifically proven that it is definitely going to help the person. For primary prevention, means preventing heart problems, as well as those who have heart problems, to prevent the second event.
All right, Dr. Dhamodaran K, cardiologist, Apollo Chennai. We do need your inputs on a little bit of some lighter noted questions. A heart-friendly habit, watching comedy shows, is that a heart-friendly habit? Would you say so?
Yeah, I mean to say making, it's more concentrating on, you are more concentrating on the stress management by telling comedy shows. You are trying to relax yourself by witnessing the comedy shows. Because you see, the psychosocial stress is also one of the emerging risk factor for heart problems. And it has been very much scientifically proven in one of the study which is conducted in India, in the heart study. So any chronic stress itself can increase the high BP, and it altered the metabolic profiles like cholesterol, everything, which is obviously the culprits for heart attacks. So stress management is one of the main factors. That's what I understand. That's what you are trying to ask me.
Yep.
So that is one part of it. And there are many other structured way of dealing with stress management, obviously. You see that mind-body exercise kind of yoga and other things also play a major role. In fact, you see, if someone does yoga regularly, scientifically it is proven to reduce the blood pressure, especially the systolic blood pressure, by 5 to 10 millimeter mercury. And the elevated high BP, high blood pressure is one of the main reasons for heart, stroke, and other things.
No, you're absolutely right, Dr. Dhamodaran. And, Dr. Vilas, you mentioned a long list of exercises. How much of it do you really take part in yourself? Because you're a busy man, and like the entire multitude out there, sometimes taking out even 20 minutes from the entire work schedule seems to be like a mammoth task. So what is it that you do yourself? What is your success mantra, doctor?
We are a member of our Power Yoga group at our Indian Medical Association office, which we regularly perform for last many years. Plus, we are often trekkers. We do trekking. We do regular walking, 10,000 steps a day. The regular, and morning hours are easy for we doctors or any busy person, because you never know what will happen once you start your work. At 8:30, 9 o'clock, once you resume your work, then the working hours are countless. They are not in our hand. So it is better to start your day early and keep yourself pumped up in the early morning hours and do the regular exercises. Whatever you like someone may like evening hours because his morning may be too early. He or she might be starting the work too early in the morning. So it's possible that he can play some indoor games like table tennis badminton in the evening hours. Some sort of exercises are mandatory. Morning or evening, which exercise that person has to decide which suits that person, he or she should continue with that exercise.
All right, Doctor, let's also continue to tell the viewers that we're going to be answering your questions as well. Please turn on your cameras, raise your hands, and drop your question in the comment box if you want any of these top cardiologists from across the country to be answering your questions. Now, Dr. Vilas has already told us and he's essentially established that just by doing mere 30 minutes for 5 days a week accounts for 150 minutes of exercise. That's moderate level, and with just moving you can actually prevent many of those heart ailments. And for those of you who are already dealing with this heart ordeal, the second recurrence can be prevented, it can be kept in check, is what Dr. Vilas is telling us. But what kind of exercise are we really talking about? Is there a specific exercise? Do we focus more on aerobic exercises, or do we talk about power yoga, just like Dr. Vilas was telling us? Those are some questions that we will take to our doctors as well. Dr. Dhamodaran, how do you know if you're overexerting yourself, let's say, in your exercises, Dr. Dhamodaran? What's your viewpoint on that?
Yeah. You might have heard certain young individuals when they are working out in the gym suddenly got collapsed and they, even succumbed. So in such situation, we have to look into it, why they suddenly succumbed. If you look into the history of their workouts, obviously they might have done a very vigorous physical activity. And recently there is a trend among youngsters, you might be knowing that, high intensity training like that, no?
HIIT. I'm scared of it sometimes. I'll tell you what, with all these cases that you're talking about, Dr. Dhamodaran, sometimes after work, I only have enough time to fiddle in and, squeeze in an HIIT exercise, but I'm unable to do that, and sometimes I choose against it. But back to you, Dr. Dhamodaran.
Yeah, sure. This is again, obviously due to the busy schedule, so-called busy schedule of the younger generation or the current generation. So they don't find much time. So what they try to do, they want to do a high intensity workouts, maybe 2 or 3 days in a week, rather than going for a moderate intensity like walking or swimming or jogging, which is more recreational kind of exercise, which usually is advocated for a long time. But at the recent times, high intensity training without supervision. It is not that all the high intensity training all bad, but without supervised program, if they do it, what happens, they will exceed or they will overexert. So what happens, some kind of block rupture or arrhythmias, which is the main reason for the sudden cardiac arrest. And you might have heard in news also, many youngsters, when they are working out in the gym, this is what happened. So when I put all this exercise for a healthy heart, for a heart healthy lifestyle practices, what I usually look at it, it should be more of a balanced kind of exercise. One should go for a aerobic exercise, kind of moderate exercise, like a walking for 30 minutes per day, at least 5 days in a week. Or one can combine that with resistance training, like kind of we have to have the muscle strengthening, other resistance, at least 2 to 3 sessions per week. So the combination, the combo obviously will help rather than going for a high intensity workout. So this is what I try to emphasize. People should have a balanced way of looking at when they come to exercise. They should not try to achieve the heart health within a day or overnight. That is not possible. That will actually lead to harmful effects.
Because the younger generation somehow feels like the HIIT and this high intensity interval training is a cheat code to lose more fat and lose more weight in a lesser amount of time, which essentially is not the truth. It doesn't happen like that. And Dr. Vilas is also with us. Dr. Vilas, people take a lot of, blood pressure medicine. If somebody is partaking in a lot of cardio, if somebody is partaking in a lot of, aerobic exercises, could one say they don't necessarily need that blood pressure medicine?
It is not like that. Exercise is mandatory for any patient who is having high blood pressure. Exercise reduces number of pills, antihypertensive tablets. How much it reduces? If someone is just doing 150 minutes a week exercise, any dynamic exercise, aerobic exercise, then there is a reduction of approximately 5 to 7 millimeter of mercury systolic blood pressure. If he remains adherent to that exercise For weeks and months together, there could be reduction of around 12 to 15 millimeter
Wow.
of mercury. Any antihypertensive tablet, one tablet approximately reduces blood pressure by 5 to 8 millimeter of mercury. Approximately, different types of antihypertensives are there. So if we remain adherent to the antihypertensive treatment, we remain adherent to the exercises regularly, you will notice that your number of tablets will reduce gradually if you remain adherent to the exercise. Exercise is producing systemic vasodilatation. Exercise reduces systemic vascular resistance. It is just like dilating the vessels, relaxing the vessel. Suppose there is a traffic jam. There is a traffic jam. There is a difficulty in passing through that traffic jam. If you widen the road, traffic will easily move. Similarly, if you do exercise, the blood will flow. If the blood will flow, then the chances of blood pressure reduction will be there, and more reduction will be there, less number of antihypertensive tablets are needed. This is for the adherent exercise schedule responsible for reduction of antihypertensive tablets. But remember, we are giving multiple other benefits by doing exercises. Not only the blood pressure, sugar reduces, weight reduces, energy level increases, mental strength increases, chances of having depression and anxiety reduces, patients start feeling well. Then there is a, cholesterol level. Cholesterol reduces significantly, and ultimately it leads to subsequently huge number of reduction of vascular events in future. So it is exercise acts just like a dilatation of the vessels, which is done by such medicines. I am not saying that if you do exercise, you will not need antihypertensive, but definitely exercise is mandatory. It reduces number of antihypertensive tablets. Plus, if you are remain adherent to the exercise, there are high chances that you will be disease free subsequently in your entire life.
Dr. Vilas, you've given us two motor analogies, one of the car standing idle in a garage and the other one is of the traffic movement. You seem to be like a car head and a car junkie to me. We can discuss that in detail later. But when we're talking about blood pressure and some symptoms that people can talk about, some underlying symptoms that won't necessarily be caught by the common eye outside. Let's say somebody who's coming of age doesn't have much medical complications, but there is a BP issue. What are some symptoms that one can keep in their mind or keep a tab on, keep a constant check on? Are there some underlying symptoms that people don't necessarily talk about or the medical books miss out on?
Yeah, the most important thing is hypertension or high blood pressure is a silent killer. Many times, patients, they do not have symptoms. That is the sad part. And gradually, the blood pressure keep on increasing, and these the digits which are very high subsequently damages the organs like heart, kidney, brain. And after having the damage, then patients start noticing, yes, there is some issue which has happened because of high blood pressure. It is not an uncommon thing in our clinical practice that patients which are coming to us have not checked their blood pressure because they were not having symptoms. True on their part to some extent, but what I would suggest that in India, when in urban population, around 1/3 of the population is having high blood pressure, more than the desired level, one should have intermittent checkups at home with home digital BP apparatus, at the level of family physicians, or you can have some health checkup plans at the corporate hospital where all these, silent things can be diagnosed. This is one thing as an asymptomatic rise in blood pressure. Second thing is headache, giddiness, palpitation, own awareness of the heartbeat, and breathlessness on exertion, sometimes sweating. These are the signs of increased blood pressure. But remember, someone may have 160, 108 blood pressure, but may not have any symptom. But if someone is having symptoms, then he must check the blood pressure. High blood pressure could be the reason of such symptoms: headache, giddiness, shortness of breath on exertion, sweating, palpitation, and some chest discomfort.
At home, so many of our mothers, our sisters, several men as well, they're now homemakers, doctor. They do all the chores at home, kapde dho liye, bartan manj liye, jhadu pocha laga liya, and they say that, we're walking around the entire house. Do we need more exercise? Is that enough? What do you say, doctor? What do you have to say to them who think that at home what they do is enough of movement and exercise?
These household chores that they come into the mild intensity exercise. And if we think of having heart protection, if we think of having protection for heart, brain and kidney to prevent the subsequent vascular event, we need some better exercises than that. Because what we have recommended in the initial part of the lecture, the exercises should be moderate intensity exercise for 150 minutes. If you are doing some household work, that is not necessarily going to give you the, that aerobic exercises are not possible to that. The heart strengthening exercises, circulation improving exercises, calorie burning exercises, muscle strengthening exercises, those are not there. It is definitely better than not doing anything. But even those people, those who are doing some household jobs, they also have to do some aerobic kind of exercises. One more thing which I need to strengthen is I need to put it into, the muscle, the core muscle, the muscles also need to be built up with some muscle strengthening exercise. It has been proved beyond doubt that muscle strengthening helps to burn the calories which we consume. It helps to reduce the cholesterol. It helps particularly to reduce the blood sugar level, because less the fat patient is having, more muscle mass the patient is having, there are less chances of diabetes, because diabetes is mainly a central obesity and insulin resistance. That is the scenario which is commonly seen. So muscle strengthening exercises also need to be combined at least twice a week along with your routine exercises. And
it has to be like a nice balance, a healthy balance of cardio exercises, a healthy balance of aerobic exercises, a healthy balance of muscle building exercises. The synthesis, purely the formation of muscle, is going to reduce fat and weight in the body, which is again going to have multiple positive benefits in the long run. Talk to us about cholesterol as well. We've spoken about diabetes, we've spoken about how moving is a medicine in its own self, but HDL, LDL, good, the bad cholesterol, and exercising, does that improve our cholesterol levels, or is that purely managed by our supplementation or our diet and is managed in the kitchen rather than the gym?
Yeah, low density lipoprotein is the LDL. LDL is the worst cholesterol. LDL is the bad cholesterol. HDL, high density lipoprotein. High density lipoprotein is the good cholesterol. More HDL cholesterol, lesser the LDL cholesterol, better for the patient for preventing future vascular events like heart attack, paralysis, kidney dysfunctions, etc. HDL just works like a vacuum cleaner. It sweeps the bad cholesterol from the vessel, away from the vessel. You do more exercise, the HDL increases, LDL reduces, and there is one enzyme which is LCET, which it forms, and that produces esterification and strengthening of the HDL cholesterol.
How often should you get your lipid profile checked, doctor? How often should I get my LDL and HDL checked? Is there an application now? Because for diabetes patients, you've got various kinds of new technologies at play. Do we have the same for heart patients, and specifically just to keep cholesterol under check, or will I have to constantly get my blood work done every 2 months?
Right. If someone who is a normal person, who just wants to do a checkups annually is sufficient for them. If he or she is having strong family history of vascular event, we suggest that start checking up from age of 35. Otherwise, above 40, annual checkups, routine checkups are essential. Blood pressure checkups, blood cholesterol checkups, sugar and HbA1c checkups, they are sufficient. But if someone is having heart disease, someone already sustained a heart attack, underwent angioplasty or underwent bypass surgery, or someone had a stroke, in that situation, initially after 2 months, and then depending upon the cardiologist or neurologist advise 3 monthly or 6 monthly, because it has been proved beyond doubt that if you bring down the LDL significantly to the desired level as suggested by us by our cardiology guidelines, then the second event is prevented. That is very clear and suggested guidelines.
All right. Doctor, it seems like another audience question for you. We have Simran with us. Simran, If you can hear us in the studio, please ask your question. We can hear you.
सर मेरा क्वेश्चन है कि हार्ट के मरीज को कौन सी एक्टिविटीज बिल्कुल नहीं करनी चाहिए?
Fair enough. That's a good question, doctor, because you've been telling us that we need to work out. लेकिन एक हार्ट के मरीज को कौन सी एक्टिविटी नहीं करनी चाहिए? What is that one movement that one should not do if they're suffering from a heart ailment? Dr. Vilas.
Right, right. Nowadays, there is no such one exercise which is not recommended for the heart patient. We give exercise prescription as like the medicine prescription when we treat our heart patient. After discharging from angioplasty or after discharging for a heart attack, we suggest them, depending upon the patient's heart pumping, what we call it as a ejection fraction, depending upon the number of vessels involved, depending upon the stents which we have deployed, and depending upon the comorbid conditions which patient have, age of the patient. Together, we suggest that you start doing regular exercises, start with simple walking, gradually increase the walking distance, duration, and then gradually increase the speed. If you are able to tolerate after first follow-up, even though the heart ejection fraction is too low, we suggest that you can gradually increase it because this is a part of rehabilitation. It has been seen that even the heart failure patients, those who are improved of heart failure, those who are intubated, ventilated, ejection fraction was low. After few days, weeks, or a month or so, if they start doing the regular exercises, their future outcome, their chances of getting repeat heart failure, repeat hospitalization, or death reduces if they are doing regular exercises. So exercises are mandatory. There are certain heart diseases where we do not suggest to do activities like contact sports, like playing rugby, playing baseball, or playing football. Such activities when the patient's heart muscles are too thickened, he is having hypertrophic obstructive cardiomyopathy, there is a left ventricular obstruction, or someone is having severe pulmonary hypertension. In such situation, we suggest them to avoid extraordinarily heavy exercises like climbing mountains or trekking or doing contact sports like such high intensity sports.
Understood.
Those are the diseases where we avoid. But nowadays, with successful revascularization and a good follow-up, proper medicines, near normal heart pumping, after angioplasty or after bypass, you are quite commonly seeing patients are running in marathon also.
Well, absolutely. Doctor, at the same point in time, that's a great opinion that you've given, and I hope, Simran, your question has been answered. Because let's not, stigmatize exercising after, a heart ailment or a surgery. It's important that rehabilitation is done, of course, under right kind of guidance from the doctors, his team, like Dr. Vilas was just telling us. Can dancing or Zumba count as serious cardio exercise, doctor? Nowadays, and it's really great to see a lot of ladies stepping out, in mid-40s, in their mid-50s, stepping out for Zumba or Pilates. That's the new in thing. Exercise is just like fashion, isn't it, doctor? Some new trend has come up. I mean, yoga was good enough, but now you yourself are partaking in power yoga because that's the new big in thing. So Zumba and Pilates, dancing, does that account for serious cardio exercise?
Yeah, this is aerobic exercise, no doubt. This is a good kind of a moderate or high intensity exercise, and moderate intensity exercises are always welcome, and this comes into the aerobic exercise and good exercise for that. Another thing is, if you are doing something during exercise which gives pleasure to your mind, then naturally the happy hormones secrete more and there will be more benefit to the organs. So if someone is fond of dancing and he or she is dancing and doing exercises, so naturally there will be more benefit than someone who is a serious patient person and who does not like to dance and he is made to dance just as a part of exercise. The benefit of the dance will be less in such patient.
Well, so are you a dancer, doctor? Or are you not a dancer?
No.
So it's basically hypertensive for you to take part in any sort of dancing activity. But it seems like Abhishek is back with us. We've been able to patch that line up. Abhishek, can you hear us? आप हमें सुन सकते हैं स्टूडियो में?
सर मेरा क्वेश्चन ये है कि आफ्टर कोविड और कहीं कहीं आफ्टर वैक्सीनेशन वैक्सीनेशन पे हम जिक्र नहीं करेंगे, लेकिन कोविड वायरस की बात करूंगा तो मैंने कई रिपोर्ट्स पढ़ी हैं और मैं लिखता भी रहता हूँ, तो ये पता चल रहा है कि कई सारे जो लोग हैं जिनको पहले कोई प्रॉब्लम नहीं होती थी, उनको हार्ट में थ्रोम्बोसिस की प्रॉब्लम हो रही है। इसको लेमन लैंग्वेज में ब्लड क्लॉट या खून का थक्का बनना कहते हैं, जो ऑटोमेटिकली पहले किसी बीमारी के कारण होता था। अब बताते हैं कि वायरस के साइड इफेक्ट के कारण एम्ब्रोजन हो रहा है, जिसकी वजह से ऑटोमेटिकली ब्लड क्लॉट हो जाते हैं और कोई सिम्टम्स नहीं आते और इस वजह से हार्ट अटैक आ रहे हैं। तो क्या सर ये वाकई में ऐसा है, थ्रोम्बोसिस की प्रॉब्लम क्या आफ्टर कोविड वायरस बढ़ी है क्या? और अगर किसी को थ्रोम्बोसिस या ब्लड क्लॉट जिसे हम कहते हैं वो प्रॉब्लम है, तो इनके सर सिम्टम्स हम कैसे डिटेक्ट कर सकते हैं? क्योंकि हम देख भी रहे हैं कि कोई भी फिट व्यक्ति है, चलते फिरते हार्ट अटैक आ रहा है, बाद में रिपोर्ट में पता चलता है कि ब्लड क्लॉट था, थ्रोम्बोसिस की वजह से डेथ हुई है। तो सर क्या ये बातें ठीक है? और एक क्वेश्चन ये, इसके साथ एक सवाल ये भी है सर, इस डर की वजह से कई लोगों ने अब ब्लड थिनर यूज करने शुरू कर दिए हैं ओवर द काउंटर ला के, कि कहीं ब्लड क्लॉट ना हो, हार्ट अटैक ना आ जाए, तो वो ब्लड थिनर खाना शुरू कर दिए लोगों ने बिना डॉक्टर की एडवाइस के। तो ये कितना खतरनाक है सर? ये दो सवाल है मेरे।
Well, all right. Many thanks, Abhishek. Well, Doctor, just to summarize those two questions for the benefit of the layman out there as well, it seems like the blood clot issue, and specifically in a post-COVID, scenario, the rise and uptick in the heart attack cases, in the heart failure cases, they had, we were reading up about them, so many of those videos that were doing the round. I'm sure you had a chance to glance at them. Thrombosis and aneurysms, and then leading to, sudden heart ailments. How do you answer Abhishek's question, and how important is a question, how important is that question, the one that Abhishek has raised in today's time?
Yeah, Abhishek has raised definitely an important question, because already, like we Southeast Asian population, we were suffering from heart problems more as compared to our Western part, and far more as compared to the Japan and China. But there is definitely an increase worldwide, globally, during particularly that pandemic of formation of the clots inside the vessels. Whether the clots were there in the heart vessels, clots were there in the brain vessels, or in the extremities. So there was an increase, because that virus has the capacity to form the clots. There was a prothrombotic tendency, even Mr. Abhishek was also rightly pointing out. But whatever has happened, that has happened at that time, and after 100 days, probably there is a so less stigma of that viral infection, or someone have had vaccination and some mild illness at that time. So there is a so less of the stigma left now, that we are now, after 5 years of that 4 or 5 years of pandemic, we have stopped asking the question that did you have COVID at that time, or did you take the vaccine at that time? Because it is like whatever has happened, that has happened at that time. COVID has occurred. COVID has produced some, in few percentage of the patient, prothrombotic tendency. We used anticoagulants during that period, including heparin, low molecular heparin, newer oral anticoagulants. But after 100 days, then everyone is equal, like you, me, and those who have not COVID. So everyone is equal. Now, as far as the blood thinner is concerned, I strongly recommend to take blood thinner only under the supervision of the doctor. And if doctor, your physician, cardiologist, or your vascular surgeon advises you to take it, then only take it, because blood thinners are producing antiplatelet activity. They are reducing the chances of thrombus formation. But if you do not have the thrombus, you do not have that tendency, or even you have it, but it is prone to give you bleeding complications. And without indication, if you take some medicine in the science, then the chances of side effects definitely increases. So that those blood thinners may produce bleeding complication. Bleeding may be there in somewhere in the skin, eyes, then it can be recovered. But if the bleeding is there in the abdomen, then it could be major. If the bleeding is there in the brain, then it can produce brain hemorrhage. So don't take antiplatelets or blood thinners just because you had a COVID at that time. COVID is over now. Like it is just like a routine infection. It is an endemic. You can say it is no more a pandemic and left now. So it is so you need not have to take blood thinner unless your doctor suggests you to and prescribe you blood thinner, because blood thinner is at the cost of bleeding complications.
All right. Well, doctor, you have sort of scared all those people that are probably popping aspirins like they were gems or some sort of candy. But you've really raised a serious red flag on that. Dr. Dhamodaran, what food habits are most important for heart health? What are some of those tics and techniques and those superfoods that you rely on yourself?
So for a heart healthy diet, though, there are, certain diets like a Mediterranean diet, diet, this diet, that diet, that may not be practical for our culture and tradition. On the other hand, what I am trying to say, overall, you should go for a more of a plant-based diet. After all, if you want to have something like a non-vegetarian, go for a fatty fish and egg whites. These are all okay. Otherwise, you should not go for a much consumption of meat, which has a lot of cholesterol. And also, the plant-based means at least 3 servings of fruits per day. That is what recommended, and also rich of fiber. This is what basically in the Mediterranean diet. When coming to the oil consumption, obviously oil consumption and the dealing with oil is more of an oily issue, and you need to be very careful about the combination. What I generally practically advise to any family member who accompanies, especially ladies who accompanies the patient, I usually ask a number of people in the family, say for example, go for half a liter of oil per month consumption. Say for example, 4 people in a family, go for 2 liters. And the ratio should be like 3:1. One part will be of a monounsaturated fatty acid oils like gingerly oil or something like that. Whereas the other one, the 3 parts will be like kind of a rice bran oil and or sunflower oil. This is the reasonable this one. More than that, we should try to avoid the trans fatty acids. Trans fatty acids means they should not. We have the habit of always conserving things. When our mama prepares something in the morning, if there is a residual balance of oil, they will re-cook it with the same oil. That is more dangerous than obviously going for this. I think Dr. Vilas also could agree with me. So that is what the main issue, oil, because the oil is the main source of fat consumption, especially in our country, where a lot of masalas and kind of curries we used to have. So this is what so more of a plant-based food substance and less of low-calorie and high-fiber diet, fruits, and obviously nuts maybe in certain amounts will definitely make the so-called Indianized Mediterranean diet. That's what I can tell you. So this will definitely help you. Obviously, one should avoid preservatives, junk foods that everybody knows about that because they're all having some of the harmful ingredients. We all know that. Yeah.
Well, many thanks, Dr. Dhamodaran, for very eloquently putting it out. Our own structured, balanced, and Indian Mediterranean diet. Let's put it that way.
I just coined the word. I may be wrong, but just to add some flavor to that talk.
Yeah, because Indian palate, we need flavor. That there's always room for more flavor that can be added into our, on our plates. Mofizol, अगर आप हमें सुन सकते हैं, please अपना question बताइए.
मैं जो सांस प्रश्वास ले रहा हूँ वह पूरा से नहीं ले पा रहा हूँ, थोड़ा नहीं, बहुत प्रॉब्लम हो रहा है, सर में दर्द हो रहा है और बॉडी बहुत वीक हो रहा है.
This is your position right now. आपके साथ अभी ये हो रहा है?
अभी हो रहा है. इसके पहले मैं कोलकाता में था और वहाँ पे मैं एक नर्सिंग होम में भी था, 60 दिन वहाँ पे था, लेकिन अभी वो हो रहा है.
Well, this seems to be like a live clinic situation, Dr. Vilas. Mofizol is telling us that he's got a headache. सांस लेने में बहुत तकलीफ हो रही है. He seems to be already undergoing some sort of treatment. How about we play out this live, doctor prescription sort of a setup? Take it away, Dr. Vilas. Any more questions for Mofizol? I can become the receptionist at the front of your clinic.
Yeah. We have to advise him whether he is having high blood pressure, whether he is diabetes, whether he is asthmatic. It could be just an asthma which is producing breathlessness to him. If he is, what was the diagnosis when he was admitted for 7 days? Was he being prescribed with some medicines? Is he regularly taking those medicines? Is he following with his doctor? And depending upon his follow-up, whether the doctor is changing the medicine, it is very difficult sitting far away, thousands of kilometers, to prescribe something on such complaints, which could be because of so many diseases. It could be because of high blood pressure. It could be because of low heart pumping. It could be because of simple asthma. It could be there because of COPD in smokers. We do not have the history, what past history he was taking and this. I would suggest he should meet a doctor with his old records and depending upon the clinical examination, necessary investigation, previous medicines what he has received, and accordingly the doctor will change the medicines and give him the best possible results.
Let's unravel this case study further. मोफिजुल, आप जब कलकत्ता में थे, जब अस्पताल में थे, तो डॉक्टर्स ने एग्जैक्टली क्या कहा, क्या कारण बताया उन्होंने?
काफी ठंडे के लिए मेरा जो है वो ठंडे के बारे में बताया, जो थोड़ा सा इन्फेक्शन हुआ है ऐसे बताया, लेकिन मेरा अभी जो हो रहा है सांस प्रश्वास जो हो रहा है बंद हो रहा है ऐसा लग रहा है मेरे को, और सर में बहुत दर्द हो रहा है, तो ऐसा ही प्रॉब्लम दिखाई दे रहा है.
Seems to be a lot of headache, Dr. Vilas, and seems to be some sort of a cold-related disease. It could be pneumonia. I mean, I'm not a medical expert here, but whatever Mofizul is telling us. But Mofizul, डॉक्टर का ये मानना है कि आपको इसी समय अपनी रिपोर्ट लेके एक डॉक्टर को दिखा देना चाहिए अपने आप को, first and foremost. Also with us on the broadcast is 𝗗𝗶𝘀𝗃𝗃. 𝗗𝗃, can you hear us from the studio? आप अपनी बात रखना चाहती थी. Would you like to do that, please?
कि हमने सोशल मीडिया पर और कई केसेस ऐसे भी देखे हैं जिसमें वर्कआउट करते हुए लोगों को हार्ट अटैक आ गया है. तो ऐसे क्या रीजंस हैं कि वर्कआउट करने के बाद भी हार्ट जो है वो हेल्दी नहीं रह पा रहा है?
That's a very good question, Dr. Vilas. Again, these questions are putting you on the spot, and I'm enjoying it low-key a little bit as well. Dr. Vilas, so many people, we've seen them running on the treadmill, picking up big weights, heavy weights, and then crumbling right then and there. Are there some telltale signs that they should understand themselves, or maybe they're ignoring? And could there be a possibility that there was no sign? A man was absolutely healthy, kept on going to the gym every day, kept on following his cardio regimen, and then one day the heart just gave up?
Yeah, it is like exercise is good. Too much exercise, and that too when you are unaccustomed to the exercise, is not good. That is first thing. Second thing, you have to look into the matter, age of the person, his family history of heart problems in the past. There is a family history many times that the father or elder brother has sustained myocardial infarction, heart attack, what you say. There could be a family history of sudden deaths in the family. Such patients should be careful for doing too vigorous exercises. One, the exercise has to be supervised. Exercise has to be gradually increasing. If you are not fit, if you are not slept well, if you are smoking, you have done a late night party, and just to complete the schedule or just to prove someone that you have done the exercise in spite of the late night party, and you are running on the treadmill vigorously, you are in 50s, you are competing with someone who is 30 and he is running on the treadmill nearby you in the next on the next treadmill. So that is not good. So exercise, too much exercise is bad. Exercise is good. This is what our science says. Like 150, good, sufficient. 150 to 270, good, continue. 270 to 350 minutes per, it plateaus. And if you increase then more, then the chances of benefit reduces. There could be muscle injury, there could be issues related with athlete heart, there could be hypertrophy of the heart, there could be chances of developing arrhythmogenic right ventricular dysplasia, there could be chances of developing a focus, rather in a late term, which can produce an irritable trigger, and that trigger can produce a rhythm disturbances into the heart and can produce sudden death. So, you have to consider all these things. If you have not exercised for last 10 years and you are doing treadmill at a vigorous pace just on a second or third day, and you do not know your medical condition, you are diabetic, you are hypertensive, pressures are not controlled, you have not taken tablets, you have smoked a lot yesterday, you are not slept well. So these are the things which are more often responsible for sudden deaths on workout. But you have seen such incidences are anecdotal. They are like
You're right,
once
doctor.
a while. But there are lakhs and millions people, they are running on the treadmill daily if you take together all the count of India. So this is once a while happening, and that too, this background is there. What I suggest is the important part, second part of your question is the signs and symptoms. Yes, this is very important. If you are not well, you are thinking that नहीं यार आज मन नहीं कर रहा है एक्सरसाइज का, just walking करो, just slow pace में अगर आप करना चाहते हैं ट्रेडमिल करो. If you are comfortable, then increase the speed. If you are feeling palpitation, if you are feeling giddiness, if you feel that there is some heaviness in the head while walking, giddiness सा हो रहा है, unnecessarily मुझे 10 मिनट दौड़ना है, I just want to complete that, don't do it. Don't do it, because you are not going to get an Olympic medal because of doing that. No, you have to just hold on at that time, think what is happening, take a rest, have few sips of water, be comfortable, take a breath. If you think you are not okay, go home, do it on the next day freshly. Next morning can be a good morning for you. Or rather than running on the same day, just chasing for the target for nothing is not good. You have to think everything.
Because these days people are wearing their
such
smartwatches and they're saying, I have to complete my 15,000 steps, the goal that I've set for myself. No matter what happens, come hail, come storm, I'll finish my 15,000 steps. And talking about completing 15,000 steps, it seems like Dr. Dhamodaran K. If somebody, let's say, is wearing a smart watch, Dr. Dhamodaran, and on the smartwatch, you can clearly see what your heart rate at that moment is. So in an HIIT setup, if somebody is going in for a high intensity training, what is that barrier that one should keep a mental note of? Isse aage nahi jani chahiye heart rate, something like that.
Recently, people are more techno-friendly or techno-freak, I can say, though they are, though we are not in fact wearing such smart watches, but when some of the patients, when they peep into my consultation chamber, they say, when I ask, are you going for a walk regular? They say, no, sir, I have completed 9,000 steps daily. You can see that. So obviously, that is another way of objectively, we cannot blame that, objectively telling that I'm doing this much of work. Scientifically, a recent study showed that anything more than 7,000 and less than 10,000 is acceptable. And if one is trying to push himself to do 15,000 or 20,000, may not be that much beneficial to the heart. And if they are healthy enough, if they don't have any other coexisting illnesses, or if they're younger, they can do it, but not for the heart healthy purpose, but for modifying the metabolic profile. Suppose if they are very obese, they can lose weight if they do more or prolonged hour, because I guess that you should have already discussed basically what is exercise. Basically, it's mnemonic, simple mnemonic, FIT, fit. That means frequency, time, and intensity. For a heart healthy exercise, you need to have a frequency of, say, as per the guidelines from Western countries, you need to do at least 5 days in a week of 30-minute session each day. And the intensity should be an aerobic exercise, kind of, say, moderate intensity, like a walking and swimming, etc., cycling. And the timing, duration matters. Duration, what they say for a heart healthy, you can do it up to 40 minutes. Whereas if one wants to lose weight, this is not enough. They have to do long hours, say, for example, at least 1 hour, 2 hours to lose weight, or to make a change in the metabolic profile. If they want to reduce their sugar level or HbA1c, obviously, they need to go for longer duration. But you see, one size does not fit all. So we need to look at their age, we need to look at their coexisting illness and their physical fitness, everything that matters. We cannot just say that you have to go for 40 minutes for an 80-year-old who is frail. So we need to see the patient. In fact, if they have to, before starting their physical exercise program, they have to meet a physician. They have to meet a physician and get a general thorough checkup, BP, etc. And if they have any coexisting illness, obviously they should do a basic cardiac workup like a ECG, echo, treadmill, etc., so that they can be on a very structured, planned exercise program. That is what matters. Just if you ask somebody, they will say, "हम जा रहे हैं एक दिन में 40 minutes जा रहा है ऐसा." Just by telling those things may not be very meaningful, especially for a patient who has got already a heart problem. That is what I try to emphasize here.
Many thanks, Dr. Dhamodaran, and especially for that, acronym, the FIT, the frequency, the intensity, and the timing. I think that should be the reason for you to draw that red line, because like we know it, the stimulus to work out is universal, but then each body is different and unique. You need to work out and cut a method that really works out for you and your body type and what you exactly and essentially want to do. I think, doctors, we're going to leave it here. Dr. Vilas Magarkar, HOD Cardiology, St. Nandalal Dutt Hospital, and Dr. Dhamodaran K, cardiologist, Apollo Chennai. Many thanks, doctors, for giving us those clear cut and practical insights, for easing it out for our viewers. I think today's session has reminded us all that heart health is not about big complicated changes. It's about small and consistent steps. थोड़ा रोज चलना, थोड़ा रोज मुस्कुराना और अपनी सेहत का ध्यान रखना, which is why we've attempted to do these webinars with the people. To everyone who joined us live on the broadcast, 𝗗𝗶𝘀𝗃𝗃, Mofizol, let's hope the very best for Mofizol, who's undergoing a little bit of a treatment as well. And remember, your heart is literally the engine of your body. तो अपना दिल है तो सब कुछ है, boss, which is why these doctors have helped us understand why it's important to take care, their own success mantras for you. Many thanks, doctors, for joining us here on the broadcast. That's all the time we have for you in this edition of Samajhdaar, Bano, Sehat ke Ishare Samjho. TV9 network and the entire webinar setup is going to continue to bring you more of these discussions. We've already had one on diabetes. Today's one on heart health. What's going to happen next and what's next on the anvil? For that, you'll have to keep a tab on our website, but it is going to happen. Many thanks for watching this one. We'll see you around.